Did you have COVID and now you have the worst ringing in your ears and you have tinnitus or tinnitus and it's driving you crazy? Because apparently when I made my long haul COVID post, these people want to know because the ringing in the ears happens. But let me show you some research. I'm Dr. Wendy. I'm a physical therapist. I am not an audiologist. I love audiologists, and audiologists are the people that I would talk to generally about this. Now, with that being said, I have a research article I'd like you to see. So in this article from 2022, tinnitus emerging in the context of COVID-19 infection seems not to differ in its characteristics from tinnitus from unrelated to COVID-19. Okay, so let's do a little bit of a dive here. So if you had ringing in your ears prior to COVID, the patients that have ringing in their ears post-COVID, it is worse if you had it before. So the research seems to show over and over again that a large percentage of people that had problems with ringing before COVID got worse with COVID. And in this particular one, 30.8% reported worsening after COVID. We know that COVID affects the nervous system, and they suspect that when you have a worsening of the ringing in your ears, it is probably due to the virus affecting the olfactory neuroepithelium. That is one take on it. Now, articles go on to say viruses in general affect your inner ear. Now, remember, I am not an audiologist. I am just reporting to you. But I will tell you personally, I at one point had the most horrendous ringing in my ears. And I went to a phenomenal audiologist who tested me and said, your hearing's amazing. And I don't understand why you have this ringing in your ears, but I don't think we understand tinnitus, and I don't think we understand ringing in our ears as much as we should, because there are multiple factors that can cause the ringing in your ears. This audiologist was a genius. He told me one of the best things that I can do anytime I experience the ringing in my ears was to get up, move around, do anything but think about it. Later on, I figured out my Epstein-Barr and food allergies were causing the ringing in my ears. And when my lymphatics got clogged, that's what caused mine. But he taught me to do my best to not think about it. And that really did help. And I also got to the bottom of it. But let's carry on. So this article goes on to say that viral infections are known to cause issues and cause hearing loss. And this can cause ringing in the ears sometimes. And this is really, really evident in certain diseases. Let's say measles, let's say herpes. Let's talk about viruses causing ringing in the ears. It's not just COVID, but COVID is here. COVID's not leaving. We're now learning. Yes, you're not crazy, but you need to know the pathology behind hearing loss and ringing in the ears involves multiple mechanisms. There is a theory that the hair in the ear is being damaged by the virus, and the direct hair cell damage, the patient's inflammatory response, or drug toxicity used to treat the infection. There are so many reasons you could be having ringing in your ears post-COVID. So the epithelium of the nerve could be damaged, the hair could be damaged, it could be inflammation, it could be a drug reaction, it could be the virus itself. The article goes on to say that COVID-19 symptoms that are attributing to some of your stuff would be the audiovestibular symptoms, such as hearing loss, which is in 7.6. There is the tinnitus or tinnitus, 14.8, vertigo, 7.2. Moreover, coronaviruses have been shown to cause peripheral neuropathy. So coronavirus, COVID, does cause nerve issues. There is a direct relationship between tinnitus and hearing loss, and most of the tinnitus patients have abnormal tests for their hearing. COVID-19 is an infection, and it can cause hearing loss, which is reported in 3.1% to 8.3% in the general COVID-19 cases, and 13.2% of the post-hospitalization patients. But if you had COVID, if you had ringing in your ears before, it will absolutely be worse post-COVID. Because remember, I've always said COVID is an inflammatory disorder, and it is like Ursula, who raises all the ships up from the bottom of the sea. COVID will come for wherever you are vulnerable and cause more irritation to what you already have. I want to do a quick shout out that if you don't know that audiologists can assess and look at this, audiologists are the inner ear geniuses that you need to see and talk to. If you can find an audiologist to get more information about this, but I promise you, you're not crazy. Your inner ear is bothering you. And if you consistently have inner ear problems, please find an audiologist because they do exist in private practice. This is different than an ENT, which those are wonderful too, and we need them. But I like to think as an audiologist as like the physical therapist for the ear because they can absolutely do a lot of cool things. And they have the cool equipment to test. Now, in this particular article, Stress and Tinnitus, they were talking about that stress and anxiety can increase the ringing in your ears. So stress, we know, is not helpful. This article goes on to say that many illnesses result in the inability of the parasympathetic activity to restore the autonomic nervous system balance. So when your nervous system becomes dysregulated, think dysautonomia, think vagus nerve issues, think COVID. The ringing in your ears could be worse because your nervous system isn't regulated. The circuits of your sympathetic and parasympathetic are always working. And one way you can look at how your parasympathetic and sympathetic are working together, your HRV, your heart rate variability, believe it or not, is a really good indicator to know. So what I'm saying to you is look at your stress, track your heart rate variability, find an audiologist. These are things that we're seeing, okay? Because your heart rate variability is a measure of stress. One more article, but this is why I'm showing it to you because I need you to know that this ringing in your ears has many factors, okay? So ringing in your ears is a disease that can even happen in people with a severed, meaning cut, no neural drive, no neural connection, a severed auditory nerve, showing that the tinnitus can be caused by abnormal neural activity that is generated in the brain without the involvement of the ear. The phantom sensations in tinnitus and the effects on the person suffering in distress are similar to those with chronic neuropathic pain. Many kinds of tinnitus are similar to phantom limb syndrome, and in these disorders, the symptoms are referred to as a different part of the body than the anatomical location of the pathology. Okay, I only share this so that you know that ringing in your ears is a multifactorial problem. Now, what we do know is COVID causes inflammation, COVID causes dysregulation. And any person who hears me talk about COVID knows that I want you to decrease inflammation and improve your rest because you need to heal your body. If you haven't seen an audiologist yet and you have this ringing in your ears, please do. If you are waiting to see an audiologist, if you are just a human who is suffering from long haul COVID, you can start to check your heart rate variability. Try to prioritize sleep. Try to decrease inflammation. Try to work on breathing. Your vagus nerve is really important for calming you down. That is the only thing I know I can say that helps. And remember the weird, fun tip I gave from my audiologist when I had the worst ringing in my ears and I felt crazy. And he said to me, people sometimes unalive themselves because of the ringing in your ears. It can get to you. Please see an audiologist. And when you have that ringing in your ears, ignore it to the best of your ability. Get up, do anything you can. Don't think about it. Disassociate that from yourself. If an audiologist sees this, please stitch this. Hit the plus sign and follow for more women's health and wellness tips. Bye, guys.